Hello, my name is Dr. Samantha Carella. I'm here to talk about autism and identifying the early signs. Autism, often referred to as an autism spectrum disorder, is a developmental disability present from early childhood, characterized by social impairments, communication difficulties, and restricted patterns of behaviors that can range from mild to severe. New findings indicate that autism now affects 1 in 88 children and is the fastest growing disability in the United States. Boys are 4 times more likely than girls to have autism. Many children with autism spectrum disorders may show developmental differences throughout their infancy, especially in social and language skills. However, because they usually sit, crawl, and walk on time, the more subtle differences often go unnoticed. The most obvious signs tend to emerge between 2 and 3 years of age. These are: is slow to develop language skills, has poor eye contact, does not or inconsistently respond to his or her name, point or wave bye-bye, smile when smiled at, play make-believe. They may throw intense or violent tantrums, resist changes in routine, and is not interested in other children or seem to tune people out. Some children with autism develop a regression in developmental milestones. They may seem to have normal development until about 18 months, after which they will gradually or suddenly stop talking, stop waving goodbye or turning their heads when people call their name, withdraw into a shell, and seem more distant and less interested in their surroundings. No two children with autism are alike, but there are some signs that many of them share, and experts agree that may be as recognizable as early as the toddler years or even sooner. Parents are usually the first to notice unusual behaviors when their child is not reaching their developmental milestones on time. Early signs of autism can be detected in infants as young as 6 months. For example, a baby may fixate on objects or does not respond to people and/or fails to make eye contact. Older babies and toddlers may also engage in repetitive movements such as rocking or hand flapping. They may play with toys in unusual ways. They will often utter the same phrase over and over, and they may also be more sensitive to sights, sounds, and touch. Don't wait. Early intervention is key. If you have concerns, talk to your doctor about getting your child screened for autism. Some professionals like to wait things out. I do not recommend this. If you have concerns, seek a second opinion with a psychologist trained in autism. Presently, we don't have a medical test that can diagnose autism. Instead, specially trained physicians and psychologists administer autism-specific behavior evaluations. Psychologists do extensive evaluations to not only look at autism, but also rule out other causing factors of what may be going on with the child. If you have concerns about your child's development, it is important to talk to a psychologist.